To start off with, as we discussed last week, there are 7 cervical vertebrae within the cervical region of the neck or cervical spine. They occupy the neck region. Superior to that, of course, would be the skull, and inferior to that would be more of the thorax of the body. What's really unique about the cervical vertebrae is that they have transverse foraminas. These foraminas, and remember, whenever we talk about a foramina, we're talking about a hole or a circle, that the transverse foramina lie on the transverse process. In addition, another unique feature of the cervical vertebrae is that cervical 3 through 7 have a bifid spinous tip. Bifid meaning that at the end of the spinous process, there are 2 projections that project inferiorly from the spinous process. Starting off with C1 and 2, as expressed last week, cervical vertebrae 1 is called the atlas. It is called the atlas, as I explained, that it is named after the Greek god that held up the world on his back. So the atlas of C1 holds up our skull. C2 would be the axis or the pivot point by which the skull rotates upon. Also, another notable character of C7 would be that it is atypical, and they have a, well, I shouldn't say they have, but C7 is very prominent. So if we place our hand on the back of our neck at the very base of our cervical, we'll see a prominence that comes out, and that is at the level of C7 of the spinous process. Starting off with C1, the atlas. Unique characteristics of C1 is that there is not a body. It is literally a ring. There is no posterior, or there is a posterior, back here, posterior arch, and also an anterior arch. Lateral on either side would be the lateral masses. You can also see the transverse foramina jetting off of the transverse process here. You can see a little bit of the odontoid or the dens process of C2 on the anterior arch of C1. C2 does have a prominence that jets upward. This is the axis point, also known as the dens, odontoid process, interchangeable. We use it interchangeably quite often. So the dens or the odontoid process is this finger-like structure that connects up to, or rubs against, I should say, on the anterior arch of C1. Inferior to that, lateral to that, you can see the facets. Facets is a joining of 2 bones together, usually a tendon or ligament. Usually ligamental, that adheres or keeps both the bones together. This would be off of the superior articular facet, and just inferior to that would be the inferior, and this would be of the C2. You can also see the transverse process. What we can't see here would be the transverse foraminas. Here's a coronal picture of C1, C2 in CT. We can see the dens process, also known as odontoid, so that would be C2. We can see the joint spaces between C1 and C2, the lateral masses of C1 on either side. Note how they are equidistant in the spacing on the superior and inferior, and also on the lateral portions. And we can also see where the atlanto-occipital joint space is, where the ring of C1 meets up with the base or the joint space of the occipital bone. One thing to note on this one are the black air-filled cells. We're going to be talking more about it as we go further into the skull, but this would be the mastoid tip. These would be the mastoid air cells. Remember, in X-ray, anything black usually is air-filled. C3 through 7 are more typical. As you can see, as we talked about and discussed last week, we have the body, which is the most anterior portion. Off of that, we have the transverse process with the intervertebral foraminas there. Posterior to that, we have the articular processes or the facets. You see the laminas in between it, spinous process with the bifid tip. Do note once again, as I explained last week, that just posterior to the body normally is the pedicle. So body, pedicle, transverse. Where's transverse? This one happens to be a little bit above, or opposite, I should say. The lamina is posterior to that, and then we have the spinous process. Here's a bifid tip, 2 projections that go off of the spinous process. And in this view, on the lateral view of the cervical, and this looks more like C7, we can orient ourselves anterior with the body, posterior with the spinous process. Transverse process. Here's the inferior articulating process. We have our superior above that. But do note, once again, the bifid tip. The cervical, or the foraminas, the intervertebral foraminas, that are part of the vertebrae above and below, as they come together, create a intervertebral foramina. They lie at 45 degrees. So in this cross section here, they have a mid-sagittal plane of the cervical, and then the coronal. If you do that at a 90 degree, and that should be from the body to the from the body to the articular facets, that 90 degrees, halfway in between, lies the intervertebral foramina. Once again, it is the bone above and the bone below that create a hole by which nerves come through. The difference between the intervertebral foramina and the transverse foramina, transverse foraminas tend to have a lot of blood vessels traveling through that through the cervical region. Intervertebral foraminas are normally nerves. So, as I was explaining just a second ago, here is C2, here's C3, and in between, anterior to the zygapophyseal joint, or the inferior articular facet, and the superior of the vertebrae below, lies a circle. That is the intervertebral foramina. This is in an oblique view. For us to be able to visualize through the intervertebral foramina, we must rotate that patient 45 degrees. Going back a slide, it lies 45 degrees either way, from a lateral or from an AP, through the rotation of the body at 45 degrees. This allows us to actually see the foraminas in between each of the vertebrae, between the superior vertebrae and the inferior vertebrae. Once again, this is where all the nerves come out of. So in counting, here's C1, 2 has a very prominent body with, you can actually see the dens process, 2, 3, 4, 5, 6, 7. T1 will have the first rib coming off of it, and that's another way. You can always check by counting downwards or upwards, knowing that if you're counting from inferior to superior, that you have to figure out which one is T1, and then you count the bodies above that. Now, there are situations where a patient will have an extra cervical vertebrae. So in those situations, it's very, very important that you're counting very correctly on all your images. The lateral, you can see spinous process of C1, the anterior arch. Here you see the dens process going up and through C1. C2 tends to have a very heavy body compared to 1, which we don't see, and the one below that which would be C3. So here's 1, 2, 3, 4, 5, 6, 7. And we can kind of see a little bit of T1. Spinous processes of 7, 6, 5, 4, 3. Do note how the spinous process of 2 is a lot heavier also. 2 and 1. Okay, little quiz here. A would be the anterior arch. B would be this whole region here, and the whole region holds the facets, but that would be called the lateral mass. The lateral mass is the pillar by which the facets sit on top of. C, transverse foramina. D, posterior ring. E, transverse process. And F, these are the superior articular processes. These are the facets that I was talking about that meet up with the axio-occipital joint. Anterior view of C2. A would be the dens process, also known as the odontoid. B, superior articular process. This is the facet. C is the inferior articular facet. And D is the transverse process. And E is the anterior portion of the vertebrae, which would be the body. This would be what vertebrae? This is probably C3, maybe C4. Anterior, orient yourself, anterior and posterior. Posterior back here. Anterior for A would be the body. This is the body. B, transverse foramina. C, in this region here, like all normal vertebrae, would be the pedicle. D, superior articular process. Also, the facet lies on top where the two bones meet. E would be the spinous process, or spinous process with a bifid tip, to be more concise. F, lamina. G is this whole region on the inside, vertebral foramina. And last but not least, H, out here, transverse process.